Hey, it's Dr. Watt from Pinecrest Chiropractic. Let's talk about two of the best modalities that we use to treat knee pain. First one is my favorite modality for this, is using shockwave therapy. Shockwave uses sound and pressure to break down those tissues. So in a few moments, I'll show you how this works. I'm going to explain it first though, because it's kind of loud. And what it uses is an air compressor over here, and that air compressor creates pressure within this piston here to shove and force pressure into our tissues. That pressure is going to break down tension in muscles, in tendons, and stimulate that healing. It's actually going to create some angiogenesis, which means new blood vessels to heal those areas. And so when we start this up, usually we'll put some ultrasound gel down on the patient, and then it's just going to make this thump, 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 thump. We can work through a ton of different tissues. Right? That example specifically, we can work through the quad, we can work down into the quadriceps tendon, or even the patellar tendon. We can work into the adductors on the inside, or work through IT band and some of the tension that you can get on the outside as well. Even in some knee cases, lower than the knee into the calf and gastroc or tibia anterior. All of these different muscles and subsequent tendons can have tons of different issues in them. When we start to break it down, they'll start to heal back up appropriately. We can change the settings within this to hit what specifically is going on with you. The other modality that we use a lot, we get to wear fun glasses for. So this is a fan favorite part of the treatment modality. We'll use these green glasses to use our laser. Laser uses infrared light to penetrate down into the tissues. Depending on the frequency and setting, it'll be 2 to 3 inches deep in the tissue. And those different settings will stimulate healing in different tissues. So it'll increase mitochondrial production, which is the powerhouse of the cell, so it makes it more energy in those areas, as well as increase oxygenation and circulation. Our body already naturally heals itself through bringing more oxygen and blood flow, using energy to do that. So it takes that process that our body naturally already has and supercharges it so it works so much faster and works really well in areas that don't naturally heal well on their own, like ligaments, who have notoriously terrible blood supply. And so as we use the laser, this one will feel nice and warm from the inside out, almost like you're eating a bowl of chicken noodle soup. And so you'll see red light's going to come out of that. That's a guide light. And we'll work through the different areas of complaint for each specific patient. Sometimes below the knee, sometimes above, depends on where your injury is once we find it. Both of these modalities are really quick, with the shockwave taking 5 to 10 minutes, and then laser protocols taking about the same time period depending on what your injury is. So these both work so well in conjunction with our other treatments, whether we're using our knee on track, the knee decompression like we've talked about in other videos, manual adjustments, and other soft tissues. All part of a plan to get you feeling the way you should again. So, if you got any more questions, I'd love to chat about it. Come on in.